morning, everyone. Sorry, I'm just running 1 or 2 minutes behind. We're just letting everyone in the lobby now, and we'll kick off very shortly. If you can turn yourself on mute, that would be wonderful if you're not by default on mute. Thank you. Okay, well, we might get started today just because we've got a full webinar topic to get through, and thank you everyone for joining us. Welcome, and just to let you know, the session will be recorded, so if you don't want your face shown in the recording, please feel free to turn your camera off. So thank you all for joining us, and sending a warm welcome to you here today with us. And yeah, for the next Research Evaluation Network webinar. It's a exciting topic today, and thank you for joining us on a Monday morning. We're Monday, right? So we have a very busy couple of months that we've just had. So first I thought I'd share all the recordings from our recent webinars that we've held that you may have missed or want to find that you want to catch up about. So I'll just share those recordings in the chat with you now. So the theme of the webinar today is holistic self-determination in an Aboriginal community controlled organisation. So for the agenda, it is a longer 1.5 hour session today because we have our wonderful guest speaker, Raymond Brunker, who's online with us today, and he's got a lot of content to cover. So firstly, I'll just do a very quick 5-minute introduction to our network and tell you a bit more about our research and evaluation resources on Community Door and our QCOS Data Hub, and including a new resource that we've just launched called for the sector called Data Point. And then I'm going to hand over to our guest speaker for today's event. Like I mentioned, Raymond Brunker, the General Manager of Community Services from the Aboriginal and Torres Strait Islander Community Health Service in Brisbane. And there will be some time for some Q&A after Raymond's presentation, and at the end I'll end with a quick overview of upcoming events and opportunities that you may like to get involved with as well. So just a quick couple of housekeeping things to note. By default you will be on mute, but your camera will be turned on. And this session will be recorded, so if you don't want your face shown in the recording, again, please feel free to turn your camera off. If during Q&A you'd like to ask a question, you can write the question in the chat. And the other option is you can use the raise your hand emoji and then take yourself off mute to ask the question. And please introduce yourself and what organisation you work for. If we run out of time during the Q&A, we can follow up with you individually after the session. Just pop your question in the chat pane. So firstly, I would like to begin by acknowledging the traditional owners and custodians of this land, the oldest continuing cultures in human history. I acknowledge the Yagara and Turrbal people of the lands on which I work here and live in Meanjin in Brisbane, and I'd like to pay my respects to all First Nations colleagues and friends joining us online today. I'm joining you from along the beautiful Maywa River in Brisbane and in West End in Kurilpa. So for those online, please feel free to acknowledge country where you are today in the chat function as well. So just really quickly for introductions, my name is Amy Dellett. I'm the Data and Reporting Analyst in the Research and Policy team at QCOS, and I coordinate these Research and Evaluation Network webinars and our online forum, as well as providing data capability support internally to QCOS and externally to our members. So if you're new to the network, welcome, and you may like to review our terms of reference, which are reviewed annually and updated as needed. And you can contact us at research@qcos.org.au if you have any questions about the terms of reference. In terms of membership, these network meetings and webinars are open to everyone as they're about sharing resources and collaboration. However, social service staff in data research and evaluation roles are particularly encouraged to attend. So the network is open to QCOS members and non-members. If you work in the community services sector and you find the webinars of value, we really encourage you to consider membership, which can be either individual or organisational membership as well. So the Research Evaluation Network is really just an opportunity to collaborate and share knowledge and ideas around data analysis, research and evaluation for the community services sector in Queensland. So you can access our Research Evaluation Network webinar recordings and resources from the Community Door Research and Evaluation Resources Hub page, and I'll share the links with you in the chat pane for you now. Put that in the chat. So we also have a research and evaluation forum that sits within the Microsoft Teams platform, and I've shared the instructions on how you can join the forum in the chat pane as well. So in terms of communication, I do also email the network about once a month with upcoming network events, so keep your eye out on those emails. And this is the last slide from me. Just wanted to really quickly touch on our QCOS data point resource. So often we hear from community services that they have issues with accessing data and not knowing where to find data. And if you're like me, you often go through or down data rabbit holes trying to locate the information you're after. So QCOS has progressed a piece of work to bridge some of the gap in relation to access to data for community services. And so we've developed a new tool which is called Data Point, and it's really to help community organisations find and locate data. So like I said, the tool is called QCOS Data Point, and I've shared that link with you. It's the last link in the chat there. So it's really been designed as a central point of access where community services staff can access up-to-date data that's relevant and meaningful to the community services sector. And it contains links to key data sources and data tools and data visualizations that are mostly user-friendly and publicly available data sets. And they're categorized across QCOS policy focus areas. So housing, youth justice, living affordability, women's equality, children and young people, and community services. And then there's also an option where you can categorize the data based on labour force and employment data too. So that's to support the sector for the Skilling Queenslanders for Work program. So yeah, reach out if you have any questions or feedback on the tool, and if there's any Queensland data or Queensland region data that you know of that we can point to that you think is missing from the tool, please reach out and flag them with us. So now it's my absolute pleasure to introduce our guest speaker for today's event, Raymond Brunker, the General Manager for Community Services for Aboriginal and Torres Strait Islander Community Services in Brisbane. And so Raymond and I only just met this year, and it's really was such a pleasure to meet you, and it's really impressive the work that you've got going on at ATSICHS. So really excited to see your presentation and hear more about this work, Raymond. I'll stop sharing my screen now so you can start sharing yours.
All right, thanks so much, Amy. Just give me one moment. All right. Sorry, I'll just bring up my screen. It's on another. Right, can everyone see the first slide? Beautiful. All right, so before I begin, I just want to acknowledge the Yagara and Turrbal peoples and pay my respects to all of our old people and our elders, both past and present. And also just a thanks to Amy and the folks at QCOS for inviting me today to present a little bit about ATSICHS Brisbane. We were really quite humble and shy, so we usually don't often do any of these things. So it's nice to, you know, break the buck a little bit and share some of our learnings and where we're at and what we're doing. So today's presentation, I do have quite a bit to get through. So if I do talk really fast, I don't mean to be flippant. There's just quite a bit to get through, particularly at the start. But basically what I'm going to do is I'm going to take the presentation really about who we are as ATSICHS Brisbane. So just a bit of background information that will set the context, and then I'll talk about what our dreaming is. And when I say our dreaming, it's really our vision for the future for ATSICHS Brisbane and what we've been doing over the past couple of years. And this is all in relation to self-determination and really understanding what self-determination means for us as a community-controlled organisation. And then from there, I'll give some kind of specific examples in relation to social services. So when I talk through self-determination, I'll then show some specific examples that you can sort of connect with, both in terms of frontline delivery and how we've sort of deconstructed and decolonised a few components of our work. And then I'll go through data and data science and what we've been doing at ATSICHS Brisbane, which is sort of semi-related to that as well. And then I'll wrap up in terms of kind of our future and where we're going. If you do have any questions, feel free to maybe put it in the chat initially, and I'll come back to the questions at the very end, if that's okay. Like I've said, I do have quite a bit to get through. And depending on time, I might even show, so I might jump out of this presentation and show some specific activities and what we're doing as well. Okay, so just to kick it off, the first one, just for ATSICHS Brisbane, we are, in terms of background information, we're a community-controlled organisation that delivers a whole range of services across the lifespan, and this includes from mums and bubs clinics to early years programs, sort of kindergartens, youth services, primary health care, medical, mental health, a lot of child protection and housing-based work and family support, and then aged care. So we, you know, like I said, it's sort of womb to tomb, and we're quite a vast organisation. In terms of over the past year, this is just some basic data. I won't sort of bore everyone with it, but, you know, this is just a bit of an outline of the sort of impact that we've had. We've had, you know, over 40 or close to 48,000 patient visits to our doctors and over 100,000 episodes of care. We also provide dental, we provide a whole range of social services and healthcare. In terms of what our community think, we have a very, very high rating. Around a little over 95% of our community would recommend our services to family and friends. So there's, you know, probably just what I'm articulating there is that there's a lot of foot traffic through our services, and a lot of our community keep coming back. In terms of who we are, I know our name is the Aboriginal and Torres Strait Community Health Service Brisbane, and that's where it started in 1973 as the second oldest Aboriginal community-controlled organisation in Australia. However, a lot of our services are really expanded across Brisbane and Logan. So our reach is there. And when you think about Logan, that's where, you know, within the 30 minutes drive of Logan Central is Australia's largest Aboriginal and Torres Strait population under the age of 25. So we have a lot of services there, particularly early years services and youth services and family support services that are based in Logan. We have a little over 600 staff, and despite the DNA and even our name being rooted in healthcare, we've been really assertive since about 2016, 2017 to have a greater focus on social services or community services. And that's where hence my role sort of began 8 years ago. And through that, we've sort of expanded into providing or trying to provide services right across the lifespan. In terms of community services, this is just a bit of a brief snapshot just to sort of lay the foundations of what I'll talk a little bit about in the future. But I've been working for ATSICHS Brisbane going on 8 years. And I always say to everyone, I give 5 years for every organisation, but I've been here 8 just because of the ability to take risks and reform, which is quite unique, particularly in an NGO environment. So about 8 years ago, we started a human services branch, which then morphed into a community services branch. And since then, you know, we've had a 620% increase and a 7 times team increase in services, in just community services. Previously, we had about 2.3 million and this is just child safety funding, well, for the branch, sorry, and now it's gone up to over 18 million. But see, growth is just one thing. And I always say growth isn't really a true indicator of how well you're doing. Growth is really just how you can market and how you can showcase what you're doing and how good you are in terms of lobbying with ministers and governments, etc. So growth isn't a measure of success. Where the real measure of success is how are our community coming to our services ongoing, so the foot traffic and the satisfaction. But at the same time, so if I think about just broadly ATSICHS as an organisation, our community brand reputation, both with, you know, other NGOs and governments and more importantly our community, that's really improved. And that's also demonstrated because you can't continue your growth if things are going really poorly. In terms of our mission, we our mission really and our vision is to create and enjoy a state of wellbeing commensurate with our culturally inherent and globally recognised rights. So what we mean by that is we're very rights focused. We're very much about how do we ensure the wellbeing of our communities, and wellbeing not simply around healthcare or social services or these little discrete programs or activities, like wellbeing in a complete holistic sense. What this means for us is kind of really three things. We have a right to self-determination as Indigenous peoples. Secondly, we have the responsibility to deliver impact for our community, but also thirdly, this idea that really focuses on for us is that if we continue to deliver the exact same thing, we shouldn't expect anything different. And when you think about a lot of, Aboriginal and Torres Strait social indicators, many of them haven't changed, but a lot of them still deliver the exact same service that we've delivered for the past 10, 20 or 30 years. So we have a bit of a different approach in terms of how we approach our work at ATSICHS Brisbane. So that's just a little bit of background information of the cultural institution and the organisation that I work for. So what I'll do now is, this is the real crux of it, is I'm going to talk through everyone a little bit about self-determination and what we see self-determination as, and then give some specific examples around social services and data. So probably the big thing is, when you, like I said a moment ago, when you think about the social indicators or close the gap indicators, a lot of them haven't been closing fast enough or dramatically enough. And traditionally, I hear around the sector people talk about, we need more employment, or we need to expand healthcare, or we need to increase funding, or greater early childhood programs, or more child protection, or smaller classrooms. And the reality is a lot of this is very transactional. It's just about how you're going to get more services, or you're trying to expand and increase more. But at the same time, as you start to expand and increase more services, it creates more siloed systems. And when I say siloed systems, particularly for families, it's for our young people, it's for our families, where we create the complexity of a service system between different, governments and NGOs and even internally. But families and individuals hold that responsibility that where they're expected to navigate the complexity of our health and social service systems. And at the same time, if you think about the history and context, often some of the various social services that are designed to protect and support so often diminish and disempower. It very much directs people what to do and how to do it. And I'm not just talking about, the criminal justice system or youth justice or child protection. I'm also talking about other NGOs, like the space in which we all work. And where this really comes from is this understanding for us at ATSICHS Brisbane that when we talk about self-determination, there's a whole history around where this is, what it's about. And self-determination for us is very much steeped in agency. So how do we have agency as Aboriginal people, for our own services, but also agency as individual families, as communities, etc. What this kind of has lent itself to is when you think about the history of Indigenous policy in Australia, and I don't mean for this to be a history lesson, but this is just setting the context for something we'll talk about in a moment. But if you think about from the 1880s up to sort of the 1940s, the big predominant theme in Aboriginal affairs in Australia was this idea of protectionism. And that's where every state and territory had a chief guardian. And if any Aboriginal Torres Strait person wanted to sort of work, travel, marry, you had to apply to that chief guardian in order to get approved. And under this idea, it was sort of viewed as Aboriginal people were legally treated as and legally regarded as children. However, you could get certificates of exemption, and in order to get those certificates of exemptions, you had to basically not associate with your traditional ties. You weren't allowed to speak language or adopt or be involved in your traditional culture. So you really had to sort of become independent and move away from culture, kin and family connections. And then, you know, a predominant theme, probably pre-1940s actually, and sort of leading up to 1960s, is this idea around assimilation. There was this idea that within 3 generations, you could remove the Aboriginal race, and it was all under the guise of the White Australia policy. This is where the removal of Aboriginal children into missions really took place from the 1880s onwards. But, you know, they're the sort of really sort of hard parts around our history in Australia. However, if, you know, on a positive spin, I always look at change, and change is always inevitable. And that's where, you know, we have had change. But however, despite that change, it's this idea for us that what you don't receive as a child is difficult for you to give as an adult. So if you've lived or grown up under an environment of protectionism or assimilation, you will inherently pass down those behaviours to your children, and then your children to their children. But like I said, change is important, and in the 70s, that's when self-determination really came through as one of the key sort of driving factors. And self-determination was this idea that Aboriginal people, one, should be recognised, but also secondly, that Aboriginal and Torres Strait people, we should also have the ability to govern ourselves to some degree, you know, and this was the rise and the start of formalised Aboriginal community-controlled organisations. Like ATSICHS Brisbane, like I said, we started in 1973 as the second oldest Aboriginal community-controlled organisation in Australia. That's just the history, but what's important is the theory of empowerment. And as I said, this idea that what you don't receive as a child is difficult for you to give as an adult. It doesn't mean it's impossible, but it's just difficult. There's barriers there. So if you've grown up in an environment where you had to keep quiet, that you were under the thumb and you blindly had to go ahead with what someone else told you to do, that includes whether it's the chief guardian or broader Aboriginal policies, the removal of children. What that does is it creates learnt helplessness as a means of survival. I know a lot of the research and, you know, AMP community people get caught up on learnt helplessness, but the second part of that is as a means of survival. And that then creates sort of some of the social decay, and not social decay, but also cultural and community breakdown. So a lot of the research that's coming out now, and a lot of you folks would know, is, as you know, one of the biggest indicators of life improvements. It isn't really just those data sets around, you know, early education and care or educational attainment rates or, you know, reduction in child protection systems. It is very much about a greater self-agency. And when you think about agency as a core concept, you know, other community-controlled organisations, including ATSICHS, it is very much about our agency to actually provide, deliver, design, think, and be accountable to our own community, as opposed to having things done to us like in all those other parts of the history of Aboriginal affairs and policies in Australia. So for us, we're very big on building agency, and building agency is a core fundamental cornerstone of when we think about self-determination. We think about it as agency. And just to sort of be grounded back to the organisation, its history around healthcare, there is a professor called Professor Michael Martin. He did what they regard as one of the most comprehensive healthcare reviews ever completed, and it was sort of the review of all reviews. And it started in the UK, but he actually came from Australia, and then he came back and did some specific reviews between Indigenous and non-Indigenous populations around health outcomes, but also the Australian public services as well. So, and it was really interesting. What they found was they really wanted to break down and understand, why do some populations have improved health outcomes versus others? What's the sort of kind of the areas of weakness or the areas that we really need to focus on in a healthcare system? And traditionally, a lot of people talk about, oh, it's all about diet, or no, it's about access to quality healthcare, or it's exercise, or it's stress, or it's hygiene. And what they found is it wasn't those individual indicators. In fact, they had a really clear, concise study, and they showed the Australian and British public servants. And they showed you that for frontline public servants, they had poorer health outcomes than their team leaders. However, team leaders had poorer health outcomes than their executive managers, and then executive managers had poorer health outcomes than their senior executives. What it meant was the further you went up in an organisation, the improved health outcomes you had. Now, immediately they said they sort of grounded itself to believing that it was about socioeconomic status, but that doesn't even explain in itself why does that actually translate into health outcomes. And so they thought it was about access, you know, that people could actually pay for other pathways for improved healthcare. And so they started to go down that path, but what they found was that was actually debunked. What it was about agency and empowerment. And what that really means is, as a concrete example, frontline public servants have the least amount of agency. When we say agency, think about it as control or decision-making in your day-to-day working life. So frontline workers have the least amount of control. They have to ask for their team leaders for approval to do this, or if they want to try this, they have to go through all the hoops. Usually their workflow is about being directed to, and then they go ahead and do that. What that does is that behaviour in, if you think about in a fortnight, you spend 76 hours at work, that behaviour of being directed to and constantly asking for permission in order to do something actually translates not just in your work life, but in your personal life as well, including when you've got a healthcare ailment. They found that people with less control or power, which is essentially agency, in their roles or in their jobs, tend to also equivalent that into their personal lives, where if they've got, a chesty cough, they often won't see the doctor, they'll wait till it gets really, really bad. So agency is about the ability to make informed choices proactively as part of core modelling. And if you think about the further you go up in an organisation, and they also did this study, they didn't just look at the public service, they looked at corporate businesses as well, that showed you the exact same sort of health outcomes. And that was really interesting, because this idea that the more control you have in your personal life, that translates to agency. That translates then to what they call pro-social health seeking activities. So when you have a concern or an issue or worry, you're more likely to get that addressed early. And this isn't just related to healthcare, but it's also related to early intervention around social services, around parents with their children and sort of needs and supports that they need. So it's sort of debunked the myth that it's all about diet, or it's all about exercise or stress or hygiene, this whole neoliberal thinking that it's about the individual. It is very much about a systems approach, and part of that is agency and empowerment. And so what we need to focus on is, how do we ensure families and young people lead their own change in the social service realm in terms of the work that we do? And that's where we come from. So when we think about self-determination at ATSICHS, we really want to focus on, how do we give more agency and control to families, to our service users, where it isn't practitioner controlled or heavily led. And that will then, lead to improved life outcomes. That is, more importantly, that's sustainable. It isn't a band-aid fix, whereas social workers, we come in and address that immediate concern and we'll advocate on behalf of them. And we're actually trying to build family and our community's capacity to advocate by themselves, but we have the responsibility to build that agency within families. And when we think about this, the real challenge isn't really about providing, more support plans or employment referrals or case plans, etc. It really is about, how do you build agency with our clients on a one-to-one level, but also at a branch level and then an organisational level. And when I say building agency, this isn't just relevant for Black Australia, it's also relevant for white Australia. I think it's something that we can all probably take stock of and take some learnings of as well. So for us at ATSICHS Brisbane, self-determination is about the transfer of power and control away from just, practitioners, whether that's social workers or family support workers or CP workers, over to families more. And it's our responsibility is how do you build families and individuals hope, belief, self-confidence, and then targeted interventions around change longer term. And that's been a really big learning journey for us at ATSICHS Brisbane. So that's just in a really basic nutshell in a presentation format. When that's our dream, that's what we think about as one of the really core fundamental visions that we're focused on in the delivery of health and social services, particularly social services, and how do we improve self-determination and agency within our community. So what I'll do now is I'll show you a bit about, sort of the community services that I operate, that I lead, and the sorts of things that we've completely changed and debunked in order to align with this focus around our self-determination operational plans. Firstly, if you think about the stock standard approach in social services, and I know this is a very simplistic form, so don't, beat me up over it, but, if you think about it, when you get a referral as an NGO, you then, go out and you get client consent, and from that client consent, you do an assessment of need, and through that assessment of need, you do a whole bunch of support and coordination, and that's supposed to lead to a client outcome. What we're doing at ATSICHS Brisbane is we've had to really deconstruct that and really move away from that pathway, and there's a whole bunch of interventions and activities that we do in addition to that and earlier instead. And this is based on some of the stuff I talked a bit about a moment ago, but it's also based on how past policies in Australia also affects our current mindset or state of mind within families, but also in our community. Just as a concrete example, if you think about, the protectionism, the assimilation, one thing that's led to is this idea of shame. And anyone, any other Aboriginal and Torres Strait person knows that you often hear this word shame, shame, shame. It's shame to do this or shame to do that. But it's actually shame to be Aboriginal, or it's shame to have an identity. Because when you strip culture and you strip identity and you strip away kinship and structures away from people and communities, what it does create a sense of shame. And traditionally, when you think about those different stages of change, when you're working with a client in social services, straight away we focus on trying to get the client consent and then trying to do an assessment. What this has meant for us is that before worrying about what to change, which is essentially the client assessment, we really need to figure out how to change in particular. How do we empower young people and families to have the motivation and belief to want to change in the first place, and really addressing some of that really core component work of shame and belief. And what that has led to is in our stages of change for our models, we have really specific activities around motivational interviewing very, very early on. And also specific interventions that when we work with families around belief and hope for the future. And I'll show you a concrete example in a moment, just an outline of the sorts of different interventions, because the model is quite comprehensive for all of our programs. But also, secondly, like I said, it's not just the shame factor, it's then that leads into belief. And, when you think about the theory of hope and belief, it's this idea that what you think about transforms into how you feel, and how you feel is how you behave. And then how you behave then reinforces what you think about. So it is very much a self-fulfilling cycle. And so your current, way of behaving, or your current way of thinking and feeling, actually sets up for your future, which then is continual. So without hope and belief, we had this idea that how do you actually build a family or a client's ability to change? So that's where, for us as an organisation, it isn't simply about, doing the client consent and then trying to quickly do this, comprehensive assessment and doing a support coordination. For our models of care, I'll jump out of this and I'll show something. This is just a workflow process, and it's the different stages of work, you know, from informed consent, and it goes into really explicit detail, then critical safety needs, and, you know, then you go, usually from the critical safety needs, you start to talk about the assessment, but we have a big kind of therapeutic alliance work, early intervention stage, so that phase 4 of all of our work is about how do we build therapeutic alliance, and this is where it's very much focused on motivational interviewing and a lot about narrative assessment tools and positive reinforcement around finding strengths in families. And why that's really important early on in the phase of work is because it really, you know, in social services, everyone talks about how everything's based on relationships, but it seems that we skip the relationship part and so focused on the assessment, and then trying to, you know, convince ourselves that we do the relationship while we're trying to do the support or coordination or the intervention work. So we do a lot of work in terms of our interventions and model of care, really focused on that, but getting smarter about it, not just, you know, saying, you know, building rapport. It's a very structured process about how we build rapport, and our practice framework goes into that to a little bit more detail. But once we get to the assessment phase, one of the things that we did at ATSICHS Brisbane is traditionally when you think about doing assessments with families, it's very much controlled and owned by the practitioner. The practitioner has all the questions, the practitioner writes all the information down. All that data, all that writing down is controlled and owned by the practitioner and the organisation. Families or clients actually don't, or many times don't even see what they've written at the end of each home visit or face-to-face session. Or more importantly, they don't have full control and ownership of it, where we do as organisations. So we're actually disempowering families and communities in that respect. And it's very judgmental, where we're making assumptions based on their answers and that control. So what we did is we created what we call narrative assessment tools. And these are essentially really large posters. And these really large posters go out within our youth teams and our family support teams or our child protection teams. And through a targeted training, I will show you some of the training that we do for all of our staff. We no longer go out with an iPad or a series of questions. And, you know, instead we use this. And the purpose of the narrative assessment tools is that families, they own this. They keep it, we take photos as practitioners, and then we go back to the office and do our case notes and upload the photos, etc. But it's a facilitated narrative conversation, not just about the here and now, but over the past couple of years. And so all of our staff are trained in Aboriginal narrative practice, and through that, you actually unpack around what the family or individual strengths are of this person that you're working with, what the sort of challenges are, but more importantly, you're drilling down to where it actually came from, what were the causal factors. So we're not just addressing the immediate needs and putting that into a case plan, and, you know, that's part of the assessment and ticking that off you know, done as we go. So it's really trying to dig deeper. And the really beautiful thing about this is we did this, you know, about 4 or 5 years ago as the first trial. And we were really surprised about the quality of conversation and the quality of insight that clients and families really expressed. And what that really was about was it was about our practice, where we're really shifting our frontline workers away from being in control of a set of questions and assessing families towards families essentially building insight into themselves. And our role is really about trying to facilitate and really explore some of those heavy topics, but also the positive ones as well. And through that, that's where, you know, it starts with my storyline, and then through the my storyline, families, they have a big toolkit of, you know, there's crayons, there's Polaroid cameras, there's all sorts of stuff in these toolkits. And we don't do this is basically the assessment. We don't do the assessment with just, you know, mum. We try to get the entire family around the table, and they all do it together. They write out or they draw all the different components of which we're facilitating in the conversation. And from there, that goes into the goals and actions for narrative assessment tool, and families then write out what the goal is, or we write it out for them through that facilitation, and then break down for that goal, what's the specific actions we need to do, or what can we do together that help support, you to get there. Number 5 and 6 is what we call a shared goal. So sometimes there's goals within families or individuals that they're in denial about. For instance, it might be around dad, needing AOD treatment. So we still have those tough conversations, but again, it was all about the power. How do we shift power away from ourselves and not control and own so much? We ensure that the first 4 goals are completely family-led, and then 5 and 6 goals, the goals that are shared with the practitioner. So these are the ones that we really force. And then, 7, 8, 9, 10, again, are family-led, then 11 and 12 practitioner shared. But again, it's really trying to build that awareness and that motivation for clients and our families themselves. And then when we do a case plan review, we use a Rivers journey, and it's really steeped in Aboriginal practice, but also motivational interviewing techniques. And probably one thing I would say about this is a lot of people or other organisations, when they've seen what we've done, they get caught up on the tool. And I always say the tool is just a facilitation of it. It's just a tool. The really important thing is the amount of time that we've put into our workforce in terms of training, but also the orientation of staff. We've, over the years, particularly with when new staff start for us, and when we first started rolling this out, a lot of our staff really, really struggled because they were in the position where they had all the information, they were asking all the questions, they were making the assessments, they were making the judgments, to essentially a framework where we're not doing that. We're facilitating the conversation. We're trying to dig deeper. We're trying to, bounce back with the families about what their motivations and values are against their current actions. And that's a very different role. It's a very different power dynamic shift. And that's been a very difficult process for our old staff when we first did it, but also our new staff when they come on board. Like I said, a lot of our family, and our assessment tools are done with the entire family. We're not focused on the individual, like if it's family support program or child protection or etc. Including our youth team. Traditionally, when you think about youth services, it's very myopically focused just to young people alone. We recognise that young people aren't born through a black hole. They do have families. We need to create strong families in order to have strong futures. The other part of it, though, is when you think about the stages of change, we aren't really just focused on, trying to get that assessment done. What we recognise is, in terms of the stages of change, the biggest time is between the pre-contemplation and the contemplation stage. And that's really about being unaware of a problem that you've got in your life and first being aware of it and contemplating that. All the research shows us that that's where the longest amount of time is taken for individuals and families. But traditionally, when you think about our models of care and social services, we skip that phase. We go straight to the preparation and then the action phase. So the preparation in terms of starting to do an assessment and then doing the assessment and providing support, coordination or interventions. So within our models, we spend a lot of time front-ending it, where we're doing a lot of that pre-contemplation and contemplation. And the way in which we do it is very focused on motivational interviewing. And these are some of the core fundamentals of social service care delivery anyway. It's very much about expressing empathy for the clients. And when I say expressing empathy for clients, years ago, before I started working for Brisbane, I used to work for the Queensland Aboriginal Torres Child Protection Peak Body. And we did a big workforce profile survey where we went out to all the community-controlled orgs, and it was really about understanding what the kind of workforce skills and gaps are and what training could look towards in the future. And one of the questions that we designed into it was asking all the workforce, how would you rate on a scale of 1 to 10 your empathy with clients? And that was always a 10 or a 9 or 10. It was a self-rated staff always rated themselves as 9 or 10. As part of that workforce profile survey, I then also went out and interviewed families of those services and asked those exact same questions. And it was really, really interesting in many organisations when we asked families and individuals about how was your worker in terms of their empathy, and we broke down what empathy meant. It certainly wasn't a 9 or 10. Some of them came back as 5 or 6 or 7 at the best. And what we found as we dug deeper in my previous role was it wasn't the fact that staff weren't empathetic. It was the fact that they couldn't show empathy. And if you can't show empathy, it means absolutely nothing when you're working with families or clients. So we, when we say expressing empathy, it's really about showing and demonstrating empathy. It's also about how you develop discrepancies between a client's goals and their values and behaviours. Just as a concrete example, if you ask a mum or dad, how much on a scale of 100, how much do you love your kids? And most mums or dads will say, 110, of course I love my kids. And then you challenge that behaviour with their action. So, if you really love your kids, a couple of Friday nights ago, you left them home alone to go out. On a scale of 0 to 100, how would you demonstrate that in love? What percentage or what number would that be? And be like 20 or 30. And so you're not, attacking them directly. It's really about challenging their value of loving their kids versus their actions. So we train all of our staff in motivational interviewing. And then it's also about not just the training, but it's the coaching. I'll share something here now, just as a bit of a concrete example. When I think about training, we did a really big piece where we, across the entire community services branch, we did all these assessments, we interviewed staff, we got their feedback, and it really led down to a comprehensive training plan. And that training plan, in summary, then focused on kind of core pieces of training for the last sort of this financial year that we're in at the moment. Some of the big pieces that we have, small, short courses that we have for all of our frontline staff. One of the big things that our frontline staff said, they don't want to do train the trainer models. That never worked, and that really demonstrated that. But also one of the big learnings that we had when we did that big review around our workforce was the fact that there was a big gap between staff going to training and learning those practice tools or interventions and ways of working, but then secondly, implementing it within their practice. That was the really big gap. So, we've done all this really good training, but the thing that we did, that we realised that we need to do was, how do we, if we're genuinely serious about self-determination, how do we shift the power and the dynamic away where we're not just telling staff to do something, but how do we actually coach them? How do we build their confidence and their belief to actually do those components? So previously, we had some senior practitioners and we moved those roles over to new roles, and it recruited some more by self-funding a few roles, which we call senior practice coaches. And the senior practice coaches across our branch essentially take a caseload of frontline staff and they go out in the field with them during home visits or during, Child Safety Service Centre, stakeholder meetings or what have you. And they coach them, they teach them how to do certain interventions or certain things that they've learned throughout the year of training. And the training is just one component, but it is really about trying to connect the ability to what you learn with your in-field delivery. The other thing that we also did and completed, which is relevant to the training, is we outsourced through an external IT company and created essentially a coaching app. And this is the dummy site, so I'm not sharing any staff data, which is good. But this coaching collective app is a structured way of doing coaching. So when we say coaching, it's not really about, a case consultation. It definitely isn't a case consultation, actually. It really is, there's structured ways around how you coach people. And it's the idea about, adult learning approach of the see, show, do model. So for all of our frontline staff and our senior practice coaches, they actually coach staff and they do it through this coaching collective app. But in addition to that, we've also moved a lot of our team leaders and managers to have more focus on coaching frontline staff. And why I'm sharing this is it's this idea that for us as an organisation, if we want true self-determination, if we want true agency within our community, within our families, we need to model that first. We need to model having greater agency, power and control for our team leaders, for our frontline staff, and not just dictating to them, this is what you're doing and this is how you're doing it. It's really trying to coach them and build their confidence and empower them as we go forward. So for us, we've really taken that approach where it's not just clients, but we've got to instill that those values in the behaviours or how we operate as a branch and as an organisation. And then finally, just as another concrete example, our work is very much steeped in power. And in some respects, it's the idea that when we've spoken to a lot of our families, a lot of our community, when we're doing reviews, and we do these things called knowledge circles, where we go out and for families or individuals that have gone through our services, I interview them and sort of get their feedback. And these are families that have gone through the whole continuum of care, families that have dropped off early, families that didn't engage. And it was really interesting because some of the things that we've found is often very early days, we essentially over-professionalised services. So a good concrete example about that is when you think about circular security, you know, it's a really big thing around how you do trauma-informed attachment interventions with families and their children. But a lot of families that we spoke to really dislike the whole idea of going to a big meeting and having a presentation or slides and being spoken to about what attachment theory is. A lot of families can't understand, okay, what has that got to do with my everyday life though? So for us, we've really moved away and debunking that, but utilising that really important information in those practices, but embedding it within a new approach. And so we do a lot of visioning and guiding. And it's this idea that in the early stages of interventions, once you're building rapport and once we are doing that motivational interviewing and starting to get that hope and belief, you also need to sort of build families and our communities' experience around what a different future could look like. And this is, where this sort of research came from, is that a lot of families and individuals that socially disadvantaged are so focused on paycheck to paycheck to paycheck. They're really flat stretched, particularly when you think about the housing crisis that we have here right across Australia, really, how tight budgets are. People can't think beyond the next fortnight or paycheck just to manage their bills, just to get their kids to school the very next day, beyond this idea around what do you want out of your future. And so we do these targeted narrative therapy sessions where it's really, building what the family, what they want out of their lives into the future and how that relates to some of the goals that are going to go into their case plan or their narrative assessment tool. The other thing that we also do is we integrate a lot of wellbeing interventions, particularly clinical mental health. So for instance, when I say integrate, it's not a referral where we refer to another agency for mental health or even refer to our own internal mental health teams and then expect families again to sort of get there and sort of do the whole assessment process again, etc. We've actually contracted Change Features, which are an external agency, and we pay for every mental health sessions with that agency. So all of our families that go through any of our community services programs, they get offered that service, and it's a little bit different. It's a little bit different where we provide the transport to that clinical session. We pay for I think it's $220 per session. We have no cap on it, whilst they're an open case, whilst that is an open case plan with us. But it's not really just about getting families to get mental health treatment or individuals for mental health treatment. More importantly, the final 10 minutes of each session, our worker then goes into the session, and that's where the psychologist or the counsellor from Change Features actually gives advice around to our worker what potential interventions could help support in the family home. So what it really is about is trying to connect the sort of clinical environment work with in-home implementation. But we don't know about what they've talked about in that 40-minute sessions beforehand. 45-minute session beforehand, but like I said, it's a really good way of integrating mental health and wellbeing beyond just this idea that when you think about social services, we think about automatically, oh, you do a referral. And I just think we've got to stop doing referrals. We've got to start doing more intensive, and not even simply warm handovers, but ongoing care arrangements for our families. But again, then finally, we do a lot of coaching and mentoring. So when, how I spoke about that idea around the circle of security and the triple P parenting classes that, sort of proliferates right across social services, we've taken the best part of it about it and have this really structured practice framework where instead of our staff, facilitating a triple P program or sending a referral for a client to go there, we actually do that through coaching and mentoring in the family home. And I'll give you an example. Years ago, I did a knowledge circle with a bunch of young mums, and they were sort of a diverse age group, but predominantly quite young, majority of them. And in this knowledge circle, I asked them, have you ever been to a parenting class? And they all sort of looked at me like, yeah, and rolled their eyes sort of thing. And I said, oh, what's your experience? And it was really deadly in the sense that a lot of these mothers were so open. We'd gained the trust and done that appreciative inquiry work early on. And one of the mums looked at me and she said, and I looked at her and I said, why is that? And she said, all I learn about is how I am as a parent. And a lot of the other mums started, agreeing and really getting on the bandwagon. And so I asked them all, well, if it's really, really bad, and going to these parenting classes that often you're forced or mandated to go to, have you ever had an experience where you thought was really good? It doesn't have to be in a parenting class, but it could be something similar. And one of the mothers, she said, yeah, years ago, when she was living in Ballina, she had essentially what she described as a family support worker, but she only came out early mornings and at night, nothing during the middle of the day. And she said she taught her in the early mornings, she said a lot of the big blow-ups in her household with her and her partner and particularly the oldest boy, and he was young, with their 3 kids, happened in the morning. And when that blew up in the morning, that set the tone for the rest of the day. And she said that family support worker was so deadly because she just had practical things, and it was really funny. The way she was explaining, she was telling me how her son, who was probably about 6, I got the sense, he hated soggy Weet-Bix, and that's what the family support worker said. Kids don't like soggy Weet-Bix, so when you do the breakfast, just make the breakfast, put it on the table. And what it did was it forced him to get out of bed real quick. He didn't have time to muck around and cause chaos, and the dad gets angry and blows off at him, and then it's all chaos in the morning. And then once he had the breakfast, she turned the shower on and he was straight into the shower. He didn't have time, and it's really just this thing about mentoring and coaching of just basic family routine and structure. But the really important thing, as she started to describe some more things, she spoke about how that work came out at night. And when that worker came out at night, it's really sort of emotional, this story, because it's really interesting. But when that worker came out at night, she said the first time she came out, she just observed. And then the second time she came out, she gave some little prompts. And it was very much an adult learning approach. But when that worker asked this mother, the worker asked her, if when you're putting your kids to bed, I want you and your partner to spend 2 minutes with each child. They had 3 kids. Just 2 minutes, look at them and talk about their day before bedtime, then give them a kiss, tell them that you love them and say goodnight. And she said, okay, yeah, that's pretty simple and easy. So she went to her first daughter, and the daughter was an infant. She was in a cot, and so I was trying to put her to bed. And her and her partner, she said she was only supposed to be there for 2 minutes, but they end up spending half an hour on that first night, and she said that's how it was pretty much every night ever since, where they just spent half an hour talking with Bub. And she said it was so beautiful. It was and she said it was one of the first times where she actually had her partner beside her with baby, without phones, without being distracted about this or that. It was only supposed to be 2 minutes, and didn't matter what the other kids were doing outside, just focusing on that child. And then she said she went to her daughter, and I got the sense the daughter probably was about 3 or 4, and they did the same thing. It was only supposed to be 2 minutes, and they spent about 45 minutes there as she was laying in bed, and then the daughter was talking about some weird story about stars or something she was trying to describe to me, but she remembered this, and it was this idea that how much time her and partner were spending with their children face to face in a really positive and attachment way. And then they finally went to their son. And again, it was only supposed to be 2 minutes, but she said it was close to an hour, and she started to ball up and get a bit teary. I said, "What's wrong?" And she looked at me and said that at the very end of that, her son reached up as she went to get up off the bed, grabbed her, gave her a hug and said, "I love you, Mum." And she said it was the most beautiful thing. And I said, "And why was it the most beautiful thing? What made you feel that way?" And she said, "Because my boy hadn't said that for the past year. He was nonverbal. He couldn't talk much." And what that learning was for us was this idea that when we think about over professionalised services, we need to move away from, the classroom presentation around attachment theory, because that there was attachment theory in action. That there was healing in action. And so we've adopted a lot of that through some coaching and mentoring, but with families and young people and individual clients. So it's really trying to move away from that. So what it really is for us is it's also about as social service providers really trying to find ways in which we do soul searching with clients and not just gloss over or merely avoid it. And I do think that creating belief and vision may be some of the most important objectives in such a world of disconnection. That's just a really basic outline of some really specific examples of the sorts of things that we're doing when we think about self-determination, how we're moving power and control away from us as an organisation and as frontline practitioners to families. But where this really comes from is that we're very, very focused on how do we listen to families, how do we listen to our community, how do we change based on what they're saying, and not thinking that we have all the answers, not thinking that we have all the knowledge and expertise, because we don't. So putting our community first. And in fact, under our new strategic plan at ATSICHS Brisbane, that's our number one value, is community first. So everything we do comes back to community being first. The second part is I'll talk a little bit about our data and self-determination. I know it's 11 o'clock already, so I'm going to whip through this super, super quick, just so you get a bit of a feel for it. But basically, when we thought about self-determination, we also recognised that we need to improve data and Indigenous data sovereignty. So what that meant was, when you think about our population, we have a very, very young population as Aboriginal and Torres Strait people. Australia has an aging population. We have the exact opposite, if you even look at that red chart there. But what this means is, at that point in time, if you think about young people are so much different. They're so much more diverse. They're so much more dispersed, digital. They're dynamic, and it meant that we had to really change our services. That's why about 4 or 5 years ago we started kindergarten services. That's why we've got more program service around young mothers and birthing in our community-based stuff, is because our population is very young and we need to provide more services in those younger years. What that means is that there is a changing nature of our community. There is the real world, but there's also the online world, particularly with young people growing up. We need to focus on how we improve our technology and our data in order to be on that online world for our young people as well. So in a really short snapshot, a couple of years ago, we invested $2 million as an organisation to overhaul all of our IT. I won't go into it all, but basically we're very fortunate that we did this IT upgrade with a view of this idea that if you want to do data science and if you want Indigenous data sovereignty, you can't do that unless you have essentially a data lakehouse and also the CRM, which is the case management and the technology infrastructure and the capabilities internally within the organisation. So over past few years, we've been really focused on improving our IT infrastructure. And where this really is about for us is, if we're genuine about meeting the totality of a family's needs, then what our vision and our dreaming for this is about, we want to create Australia's first Indigenous wellbeing model in the digital age. And what I mean by that is, just on the community services branch, I have 17 different case management systems that we mandated to use by different funding agencies. And even within funding agencies, there's different case management systems within different case management systems. So we want to get to the vision where we have one single case management system, where instead of families trying to be diverted and referred to a whole bunch of different services, we can see their whole journey at ATSICHS Brisbane. And part of that, what that will mean is that we can then start to do predictive analysis and artificial intelligence around predicting what families require and connecting that system. And what that really means in the most basic fundamental nutshell is when, say, if in the family support team, if they're working with a family, and we put down in the client details that there's a child that's 3 or 4 years of age, what this will do is it'll automatically track that child's name against the kindy enrolment software, and then if that child hasn't been enrolled into kindy, it gets an automatic referral to our kindy enrolment officer, which works in our kindergarten space, and that kindy enrolment officer then engages with the family. What it really is trying to do is, because we've got so many different services in the organisation, it's really unrealistic for our staff to know all the different programs, all the different eligibility and how to get there. So this is the point of creating one case management system. One of the things that we had to do in order to achieve that was, not to get too technical, but we had to get application programming interface approval, which we call API, of all of our different funding bodies. And one of the big ones was child safety. So we've got that. So what that means is at the moment, we can extract all the data into one centralized location and we can see it all. And when I say data, I don't mean numbers. I mean data in the sense of assessments and client details and, you know, the different teams that are working. And again, for us, it's really this idea that we want to create a holistic model, but using technology as a leverage way to improve that client journey and connect up different parts of our system. The impact for us is it's really, we have this mindset that, you know, change is going to be inevitable, and technology and social evolution will not wait for ATSICHS Brisbane. So technology and data analysis go hand in hand, and that's why once we did the IT infrastructure and the IT roadmap, we then embarked on a data science roadmap, and we engaged QT, the Centre for Data Science, and just off the front, I have all the time in the world from QUT. They've been really, really fantastic in terms of working with us. From there was a final report that was delivered to us. They did some big internal reviews about data science and what can we do and how do we actually get there. So then we created a data science roadmap. I chair that steering committee. And there's some building blocks of our data science, which is really focused firstly on data governance and then digital platforms and analytics and then R&D. What that has meant over the past couple of years, this is the BARDA data science maturity curve. We started there, but now we're sort of getting into the phase of being integrated. We have our first data scientists on full time. We have a whole range of different things and data capabilities. I know the rudimentary stuff is around dashboards and, you know, performance dashboards. We have all these different dashboards around performance, so we know how we're doing as an organisation. But then we've also looked at IT infrastructure that can also support service delivery and social services. So, for instance, one of the things that we have is through our online MobNet and performance and coaching portal, every month, every staff member, including myself, all my direct reports, I have a monthly supervision meeting with them, and we go through a whole bunch of different development goals and actions and other bits and pieces. But staff also do this thing where they rate me, and they rate their direct line manager about what they think about their direct line manager according to our organisational values. And I rate them, and then we have a conversation. And what it really is about trying to be transparent. And really, again, if we want to listen to communities, we also need to listen to our staff. We need to break down that hierarchical structure where it's essentially just a top-down approach and what we think is given. But then once staff do this, this actually goes in automatically into a dashboard and shows you what the average staff ratings are across the teams, across all our different teams. It's probably interesting for one of our teams, it started to get really low. And when we looked at it, we found that the supervision actually wasn't being completed in one of the teams. So we have, you know, the IT capability where it's not just about doing the activity, it's about ensuring that there's transparency, that we are very focused on feedback, particularly, you know, the further you go up, you know, how I showed you that slide about the Michael Marmot learnings around healthcare. the further you go, more power you have. We're trying to disperse that power and create that even balance as well. The other thing, I'll just go through this pretty quickly because we do have a bit. This is just our data platforms, just in a basic nutshell, is we've created a lot of it based on the Microsoft Suite not-for-profit platforms, and the reason for that is this work that we've done for our data science capability and our IT infrastructure, and we're working with the Indigenous Data Network in the University of Melbourne, and the idea is that we can then give this to the IDN, and that any of the community tribal organisations across Australia that would like to use it for free, we're more than happy to. But, you know, in terms of data, I'm looking at the time, I probably don't have the time, so I'm going to really skip through this. But probably one thing is, if I think about data and data science, the other things that we're doing is we're not just about, you know, having a data science capability, having really good dashboards or having really good clear staff feedback. It's also about community feedback as well. And traditionally at the moment, a lot of our community feedback's done by our research teams, or it's done by myself and our managers directly with clients. One thing that we are working with QUT on a really large project on at the moment is there's these tools called session rating scales and outcome rating scales, and they're brief screening tools that traditionally mental health clinicians use. So every time a mental health clinician will engage with a client, at the end of the session, the client would rate their mental health, that session experience, what the relationship was like, they focus on goals and topics, etc. And then they would do a brief wellbeing, where their wellbeing is. That then leads to a little platform, and it shows you, on a graph to the practitioner, where they are at with the client's wellbeing versus how each session's scored based on the client's perspective. We're working with QUT, and we're actually developing our own platform, which is like this, but instead of just having those questions around generic wellbeing, we're focused on agency. So is it being, is the power and control with the family or the client? And the whole idea for us is that then by the end of the year, that this client feedback mechanism will happen every face-to-face visit or session with every client across our team. So we're moving away from client feedback that happens once every 3 months or sporadically towards every single session. But more importantly, all of this data only goes to frontline teams. It doesn't go to me as the director. It's not about surveillance. It's not about, managing staff. It really is trying about empower our frontline staff about what our families or clients think in terms of wellbeing. And if the charts are going down, hey, maybe my intervention of this toolkit isn't working, I need to change to something else. Or where we want to be in terms of in 2 years' time is that as a mature organisation, that staff have that safety where they can recognise that, hey, this relationship with this client just isn't working. And that's not a reflection of them as well. It's not a reflection of that client. It's just a reflection of that. In human nature, you don't get along with everyone. And in social services, that shouldn't be the case either. So just to wrap up, I'm looking at time, so I'm just going to finish this off. But basically, so just in terms of wrapping up, in the future dreaming, if you think about ATSICHS Brisbane, our head office is at Wollongabba, and Wollongabba in Turrbal Yagara language is Wollongabba, which means whirling water, and Yagara it's Wollongabba Wulun, which is Fight Talk Place. And so we have this mindset about all of what we do when we think about self-determination, deconstructing how social services operate now and what we need to do differently is based on this idea that we need to fight and talk over it. We can't just accept it as truth, and what truth is for the rest of social services might be completely different to our experiences, urban, Aboriginal and Torres Strait people. And the whirling waters is the notion of the brackish waters of the seawater coming into the Brisbane River. And so it's not just about us getting our way or trying to do things our own way. It's about how we also work with others and partners and grow our understanding. And so the next milestone initiatives that we have is that we've just funding our own cultural service. And when I say cultural service, we're actually providing, we will be providing services to our families. So when you think about doing an assessment with young people or families, there will also be a cultural assessment, and then we'll be able to provide in-house cultural services, but also external cultural services that we'll pay for, that are pro-social, that just aren't needed. And this idea that culture as a fundamental cornerstone of wellbeing. The other thing that we're going to be doing is a really large community census. This is based on Yawuru population census that they did, which is a small community, Aboriginal community organisation in Broome. We have a 600 workforce. We want to go door knocking to a number of suburbs or key suburbs across Logan, to every household, to come to First Nations household, and then ask them and do a census with them. But the census isn't about, how many people live in a household, what your income is, none of that. Like, we want a strength-based census, and we want community to have input around and trying to understand. The big question for us is, what does a thriving urban Black family look like? What are the different indicators from that? When we have that, that's going to lead into a broader assessment. So, at the moment, a lot of assessment tools that we have are mandated by government departments. We'll then have one assessment that we'll use from primary healthcare through to aged care to early childhood, the whole lot. And then that will have a profile based on our community's perspective of what thriving urban Black families are versus where we are at. And that will also create a lot more transparency for us. We're also doing a whole bunch of other things on the side, which is about challenging some kind of key areas such as youth justice and the out-of-home care system in Queensland. In fact, we've just in the final stages of getting a brand new, very unique program that we pitched to the Child Safety Department around kidship care in Queensland. And then we're also starting off a community insight team. So move away from, when we think about insight, it's very much around data and surveys and forms, dropping all that, and it's really at community, it's the narrative, it's the talking, and packaging that information up, giving it to frontline teams, and then giving them little budgets around what they think the solution could be, and giving them the right to exercise solutions and implementation of those solutions. Just finally, the learnings for us is when you think about empowerment and self-determination, we actually have a really comprehensive roadmap and an operational plan. So most organisations have a strategic plan, then you might have an operational plan for each branch and then program or team. We have, outside of that, a roadmap and operational plan, which we call the empowerment roadmap. And because if you're going to try to do self-determination activities, or you're trying to reform, or you're trying to decolonise yourself in the way everyone thinks and do things differently in order to improve impact, you have to be concerted about that. It's very easy to have strategic drift or to be focused on crisis. So that's been one really good learning for us. The other thing is that we also have independent critiques. So some of our life members, we have different, when we do the knowledge circles with the families, they critique us around certain things. That's in terms of initiatives or programs or ways of doing things and going back and seeing how we went. But we're also just about to recruit another role internally where it's going to be separate from the branch, where they can then critique how myself as a GM and my leadership team, how we've implemented it. So it's not simply just the idea or the outcome, but it's also the execution. And more importantly, it's the space and time to think. I think about, as a culture, we've been on this earth, on this great land, this country for over 40,000 years, and we have a very, very, very long history. And probably the learning for us is that we're so focused on impact and getting things done fast. Some of the best things that we've done has come through wisdom. And I remember years ago, one of our uncles, he said to me that wisdom isn't knowledge, it's the passing of time when you get knowledge. It's the sitting with, it's the pondering, it's the thinking, it's not just getting it and putting it into action. So probably one thing that we've learned for us. That's it from mine. I know it was a lot to get through. I didn't manage to go through all the other things I was going to show you, but it's just, I hope you've sort of got a bit of an understanding from ACCS Brisbane's perspective, particularly social services, what we think is self-determination.
Well, thank you so much, Raymond. That there was just so much to go through, so much learnings, and yeah, we just really appreciate your time to share this. And we did. I just wanted to know if anyone had questions. We didn't have anything kind of come through in the registration process, but if anyone wanted to take themselves off mute and ask a question, there's a couple of comments in the chat at the moment. I don't think there's specific questions. They were just one person had to run off and they just said thank you. It was amazing. And then just some reflections, really saying. Often we find it's a telling not listening approach, and they liked the river poster ideas around changeable journeys for young people. We've got questions come through with the hands up, so we might start with who I can see on my screen first. So Lindy, did you want to take your self off mute?
Thanks very much, Amy. Can you hear me?
Yes.
We're using different headphones today. So thank you so much, Raymond. I just want to congratulate you and your organisation for the amazing work that you've been doing over the last while. I'm from Wanjing Aboriginal Corporation. I've been there for 12 years over in WA in Bulu, Perth. So, you know, and on a similar kind of journey as what you are, but you seem to have really nailed it. And I can't sing your praises enough. I think it was such a brilliant presentation. One question I did have for you, and similarly to you, we've got, you know, number of contracts, I think 47 contracts with different funders. So what that means to us is that there's a whole range of different funder-defined outcomes that need measuring and so on. So I was so interested in looking at the way that you've kind of flipped that, but I was also wanting to find out from you if you have any kind of, well, what has been your history of like grappling with the funder about measuring, like, because do you also measure those funding contracted indicators, or because they are kind of, you know, not necessarily meaningful to the community, they're more about, you know, the government stats? So yeah, sorry, I'm saying too much, but I think you know what I'm saying.
Yeah, I think what the approach that we took was we were very, very frustrated about particularly state funding. A lot of their assessments, a lot of their tools, a lot of their performance measures, and are just so far removed from what impact equality is. For instance, in a lot of state funding, particularly child safety funding, it's all focused on hours, and so you have to look at how many case management hours that you've delivered to families. And so our staff on the front line are recording every 15-minute intervals, and like it's just mind-jarring. So what we did was, one of the first things we did was we started with a youth team. We have a very large comprehensive youth team that's funded by Child Safety. So we did a whole bunch of design jams with them and designed a brand new model. But we brought them along the journey. And through that, we wanted commitment that it's not just redesigning the model of care based on the new knowledge that we're getting, but the two biggest gaps is, as organisations, there's no point doing co-design of model of care if you can't co-design the contract, because traditionally the contract and the output targets have nothing to do with the model of care, and in fact you then water yourself down to providing a service which is quite generic, which isn't very intentional because you're so focused on chasing or garnering these outputs which don't align to your model of care. So we did that with the youth team, and the department were very happy to accept it. So for our youth support service, we're the only one across the state that has dropped the hours or dropped all those output measures. And our output measures are based on our model of care. So it's the different stages of work and how many young people are going through those, which is really good. So we took it in our own hands, where we thought, let's see if we can build a bit of a strategy of bringing the department officials in and co-designing that and changing that. That was really good, because then that also put and applied pressure for a lot of their other child safety funding to drop their hours. And so our intensive family support, that's been dropped, and family wellbeing, they've committed that that's going to actually drop as well, because and so for us the mindset is, when we think about self-determination, we need to do it where it's in our control. We're not just saying to the department, hey, we want this, we want that. Like, what's the best way and what's the best strategy to bring them in and not see it as adversarial? And that comes back to that notion that I mentioned earlier about we learned, the whole whirling waters within Turrbal. It's this idea that we got to work with other stakeholders, whether that's in departments, and really trying to bring them in and cooperate and negotiate. And that's been really, really useful.
Thank you very much. Thank you.
Thanks for the question, Lindy. That was great. I think we could have one more question. So I might ask Susan, did you want to take yourself off mute?
Thank you so much. Thanks, everybody. And thank you, Raymond. What an amazing presentation. My name is Susan Wyatt. I'm a Research Evaluation and Strategic Officer with QPAS, so working with torture and trauma survivors that have come to Australia. I've only been back in Australia about 3 weeks, so this is kind of mind-blowing and very interesting for me. But leading off this last question a little bit, I've got two questions. One is about how do you merge, or how do you kind of pull apart the different worldviews sitting in and positioning it in a different, the Australian government kind of worldviews and value systems when you're talking things like child protection and social services. How do you manage those discrepancies, or where do they work together, where do they not work? And secondly, looking at agency, obviously when we're doing trauma recovery for people that have survived torture and trauma where they've really had no choice and control, trying to promote agency and empowerment, we're very strong on that. But there's a little bit about when there's that responsibility vacuum, when you're getting people that have really never had much agency, just suddenly have full agency. Sometimes there's this gap in between, and there can just be nothing happening because they can't even imagine, what that would look like. So how do you balance that without taking over and becoming professional-led again?
So the first question is, the different worldviews. I suppose it's just how we lead. I don't get caught up in what different stakeholders or different government agencies, or if it's different to us, that's okay. What we're very, very focused on is what's in our control. What can we push? What can we help change? But in order to do that, I think it all comes back to collectivism. If you think about anything that's, the policy changes that happen in Aboriginal affairs in Australia, it's because you had collectivism. And when collectivism in the sense of all Aboriginal and Torres Strait Islander people coming together and working together, but that collectivism also be extended out to other NGOs and other government departments, etc. I know for, within certain regions and certain departments, there are huge advocates for us that have really approved and done things that even I thought, there's no chance, absolutely no chance this is going to get across the line. But it's the relationship that we have with them. But it's not a relationship where we're subservient. It's a relationship where they really respect us. And it's because we haven't attacked them or just critiqued them. We've just focused on what the positive experience and positive change mechanism is. And I firmly believe where you get the best change is because of positive reinforcement. It isn't the negative. It's not the fear-based stuff. So that's one thing to answer that question, we really focus on what we can change or what we can control through positive measures, not for, getting caught up in ideology of this person or, that youth justice system. Well, that's okay. What are we doing to try, shape, mould and move that? In terms of the agency with frontline, clients, I completely agree. And probably the big learning for us is that whole thing that I mentioned earlier, where in our stages of care, it's overwhelming, but I tend to think it's almost like paralysis by change. So it really is slowly, but very, very early on. But in order for that, a lot of the interventions that we have, when I say interventions, they're not just, traditionally we think about behaviour change interventions. We're not focused on just the individual, because this is weird neoliberal thing where you blame the client. And even one of the things that we learnt as well is when we started talking about the motivation of clients, and this is to be really honest, early days our staff would then say, No, the client has got motivation, so it's yeah, we'll close that case. I'm like, no. Our responsibility is to build that motivation. You can't just ascribe that judgment to a client. They've, closed up earlier a DNA, and it's they're to blame. Like, absolutely not. And so it was one part of it is the corporate culture. It had to rein that in really quickly. We didn't expect that, to be honest, but that did happen. And then having for each model and each program that we have, there's specific interventions, and we allow a lot more time early on to do all those, which is around the introduction of agency and some of those core ones that I did mention. It is around the Aboriginal practice. That's been really, really good. And I tend to a lot of our community and our culture is pedigree and storytelling and yarning, but we don't actually practice that when it comes to delivery of services. So we've really embedded that very, very early on. And then the sort of visioning towards the future before we even start talking about what the issues are.
Thank you so much for the question, Susan. I think we're going to have to wrap up now. So just an incredible thank you, Raymond. We just really appreciate your time today. I've got so many wonderful reflections, but I'll take some time, as you recommend, just to sit and think more deeply about what you've presented on today. We're just so much information and a wealth of knowledge. So we just really appreciate your time. Yeah, my takeaway reflections were, that to provide, deliver, design, and think and be accountable to our own community. That's what, what self-determination is, what you're talking about. So, yeah, thank you so much. And I'm just aware, so we've got some people that have had to duck off. I'm just going to take a couple more minutes just to go through the final slides, but I have already shared some upcoming events that people might like to get involved with. So I'll just share my screen really quickly, and we'll go through what's coming up. On the 9th of May is our next webinar, and it's on data privacy and capturing consent, and it will be co-hosted with our Quality Collaboration Network, and that's on the 9th of May. Registrations are open for that event now, and so you can register through the links that I've shared in the chat. We also have on the Thursday, the 23rd of May, you mentioned, Raymond, that you previously worked with the Queensland Aboriginal and Torres Strait Islander Child Protection Peak. So we have Candice Butler from the Centre of Excellence going to come and talk to the network to unpack some key considerations, principles and values and standards of their recently developed evaluation framework. And that really is, again, an opportunity for deep listening and learning about culturally safe evaluation from an evaluation leader in the community controlled sector. So really looking forward to that session as well. We also have another session later on in the year on the 17th of July on data governance and benchmarking. And I just thought I'd briefly mention also there's the Asia Pacific Digital Transformation Program, which people might be interested in. There's a series of free digital webinars starting from the 1st of May and some coming through to mid-May around Power BI and theory of change, information like that. So I've shared that in the chat as well. And lastly, QCOS has a number of in-person town hall events coming up. So in Mount Isa, Logan, Gympie, Cairns, Toowoomba, Gladstone, Rockhampton, Moreton Bay, Mackay and Brisbane. And I've again shared those links in the chat. So thank you all very much for staying online today and engaging with our discussion. We just have some final polls. I've shared Raymond's contact details in the chat as well, and we'll share the recording at some point in the future in a post-event webinar email. So if you're happy to stay a couple more minutes to capture those polls and give us feedback on how we've gone today. So yeah, just some more comments in the chat as well, saying thank you, excellence in action. I have hope for the future. True yarning takes time and patience. Thank you very much for the informative session. That was from Janine. And Shree said, thank you, great work. And Michelle saying, amazing presentation. Thanks so much from Quatsip there. Apologies again, everyone, not the best with keeping the time, but sometimes it's worth having that little bit of extra opportunity to ask questions. And thank you, everyone.